Hi and welcome viewers of Nursing Academy 101. In this video, we will talk about latest psychosocial integrity related multiple choice questions for nurses along with the answers and rationales part 2. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A nurse is caring for a client with borderline personality disorder who is exhibiting self-destructive behavior. Which nursing intervention is most appropriate to address the client's self-harm tendencies? A. Providing a safe and structured environment. B. Encouraging the client to express their emotion freely. C. Administering sedative medications to promote relaxation. D. Implementing punitive measures to deter self-harm. The answer is A. Providing a safe and structured environment. When caring for a client with borderline personality disorder who exhibits self-destructive behavior, the priority intervention is to provide a safe and structured environment. Creating a safe environment involves removing objects that could be used for self-harm and ensuring continuous supervision as appropriate. Structuring the client's routine and activities help minimize impulsive behaviors and provides a sense of stability. Question number 2. A nurse is caring for a client with a history of alcohol use disorder who is experiencing withdrawal symptoms. Which nursing intervention is the priority during the acute withdrawal phase? A. Monitoring vital signs and assessing for signs of delirium tremens. B. Administering benzodiazepines to manage withdrawal symptoms. C. Providing a quiet and calm environment to reduce stimuli. D. Offering fluids and nutritional support to prevent dehydration. The answer is A. Monitoring vital signs and assessing for signs of delirium tremens. During the acute withdrawal phase of alcohol use disorder, the nurse's priority is to monitor vital signs and assess for signs of delirium tremens. Delirium tremens is a severe and potential life-threatening complication of alcohol withdrawal that is characterized by autonomic hyperactivity, altered mental status, and perceptual disturbances. Timely recognition and appropriate management of delirium tremens are critical to ensure the client's safety and well-being. Question number 3. A nurse is caring for a client with an eating disorder who is resistant to nutritional rehabilitation. Which nursing intervention is most appropriate to address the client's resistance? A. Encouraging the client to engage in group therapy sessions. B. Implementing a behavioral contract to establish goals and rewards. C. Administering appetite stimulants to increase food intake. D. Allowing the client to skip meals to maintain control. The answer is B. Implementing a behavioral contract to establish goals and rewards. When caring for a client with an eating disorder who is resistant to nutritional rehabilitation, implementing a behavioral contract to establish goals and rewards is the most appropriate intervention. Behavioral contracts allow the client to take ownership of their treatment and establish achievable goals. By providing rewards or incentives tied to meeting those goals, the nurse encourages the client's compliance and motivation for nutritional rehabilitation. Question number 4. A nurse is caring for a client diagnosed with depression who is prescribed selective serotonin reuptake inhibitors (SSRIs). The client asks the nurse about the expected timeline for improvement. Which response by the nurse is most appropriate? A. You should notice significant improvement within a few days. B. It may take several weeks for the medication to reach its full effect. C. You should start feeling better within a month of starting the medication. D. Improvement can be expected after the first dose of the medication. The answer is B. It may take several weeks for the medication to reach its full effect. When caring for a client taking selective serotonin reuptake inhibitors (SSRIs) for depression, it's important to inform the client that it may take several weeks for the medication to reach its full effect. SSRIs require a build-up period in the body before they effectively regulate serotonin levels and alleviate depression symptoms. Managing the client's expectations and providing accurate information help prevent frustration and promote adherence to the prescribed treatment plan. Question number 5. A nurse is caring for a client diagnosed with Alzheimer's disease who is experiencing agitation and aggression. Which nursing intervention is most appropriate to manage the client's behavior? A. Administering antipsychotic medication to control symptoms. B. Engaging the client in reality orientation activities. C. Creating a calm and structured environment. D. Applying physical restraints to ensure safety. The answer is C. Creating a calm and structured environment. When caring for a client with Alzheimer's disease who exhibits agitation and aggression, the most appropriate nursing intervention is to create a calm and structured environment. People with Alzheimer's disease often become agitated or aggressive due to environmental triggers, confusions, or frustration. Providing a calm and structured environment, free from excessive stimuli and chaos, can help reduce agitation and promote a sense of security and well-being for the client. Question number 6. A nurse is caring for a client with schizophrenia who experiences social withdrawal and decreased motivation. Which nursing intervention is most appropriate to promote client engagement in social activities? A. Encouraging the client to attend large social gatherings. B. Providing opportunities for one-on-one interactions. C. Suggesting the client join a competitive sport team. D. Allowing the client to choose isolation if desired. The answer is B. Providing opportunities for one-on-one interactions. When caring for a client with schizophrenia who experiences social withdrawal and decreased motivation, the most appropriate nursing intervention is to provide opportunities for one-on-one interaction. Large social gatherings may be overwhelming and exacerbate symptoms. One-on-one interactions allow for a more manageable and supportive environment, promoting engagement and socialization while respecting the client's comfort levels. Question number 7. A nurse is caring for a client diagnosed with substance use disorder who is experiencing withdrawal symptoms. Which nursing intervention takes priority in managing the client's withdrawal? A. Administering medication to alleviate withdrawal symptoms. B. Providing a quiet and comfortable environment for rest. C. Encouraging the client to engage in therapeutic activities. D. Monitoring vital signs to detect physiological changes. The answer is D. Monitoring vital signs to detect physiological changes. When caring for a client with substance use disorder experiencing withdrawal symptoms, the priority nursing intervention is to monitor vital signs to detect physiological changes. Withdrawal from certain substances can lead to severe physiological manifestations, including fluctuations in blood pressure, heart rate, and respiratory rate. Monitoring vital signs helps identify potential complications and guides appropriate interventions. Question number 8. A nurse is caring for a client diagnosed with bipolar disorder who is experiencing a manic episode. The client's family expresses feelings of frustration and exhaustion. Which nursing intervention is most appropriate to support the client's family? A. Providing psychoeducational about bipolar disorder. B. Encouraging the family to take breaks and engage in self-care. C. Assisting the family in developing coping strategies. D. Referring the family to a support group for caregiving. The answer is B. Encouraging the family to take breaks and engage in self-care. When supporting the family of a client diagnosed with bipolar disorder experiencing a manic episode, the most appropriate nursing intervention is to encourage the family to take breaks and engage in self-care. Caring for a loved one with a mental health condition can be physically and emotionally demanding. Encouraging self-care helps preventing caregiver burnout, reduce stress, and enable the family to maintain their own well-being while supporting the client. Question number 9. A nurse is caring for a client with borderline personality disorder who engaged in self-harming behaviors as a means of coping. Which nursing intervention takes priority in addressing the client's self-harm tendencies. A. Providing education on health coping mechanism. B. Developing a safety plan with the client. C. Administering medication to alleviate distress. D. Encouraging the client to participate in group therapy. The answer is B. Developing a safety plan with the client. When caring for a client with borderline personality disorder who engaged in self-harming behavior, the priority nursing intervention is to develop a safety plan with the client. A safety plan includes identifying triggers, warning signs, and coping strategies to use instead of self-harm. This intervention helps empower the client, provides alternatives for managing distress, and promotes a sense of control and safety. Question number 10. A nurse is caring for a client diagnosed with major depression disorder who is at risk for suicide. Which nursing intervention takes priority in ensuring the client's safety? A. Assessing the client's suicide risk using a standardized tool. B. Establishing a one-on-one observation with the client. C. Administering antidepressant medication as prescribed. D. Collaborating with the client's family for additional support. The answer is B. Establishing a one-on-one observation with the client. When caring for a client diagnosed with major depressive disorder at risk for suicide, the priority nursing intervention is to establish a one-on-one observation with the client. One-on-one observation ensures constant monitoring and minimizes the risk for self-harm or suicide attempts. This intervention provides immediate support and helps maintain the client's safety while further assessment and intervention are implemented. Question number 11. A nurse is caring for a client with major depressive disorder who is at risk for suicide. Which nursing intervention takes priority in the client's care? A. Assessing the client's suicide risk regularly. B. Administering antidepressant medication as prescribed. C. Encouraging the client to attend group therapy sessions. D. Providing the client with a safe and supportive environment. The answer is A. Assessing the client's suicide risk regularly. When caring for a client with major depressive disorder who is at risk for suicide, the priority nursing intervention is to assess the client's suicide risk regularly. Suicide risk assessment allows the nurse to identify any changes in the client's condition or the presence of warning signs. It helps ensure the client's safety and allows for appropriate interventions to be implemented promptly. Question number 12. A nurse is caring for a client diagnosed with schizophrenia who is experiencing command hallucinations, instructing self-harm. Which nursing intervention takes priority in managing the client's safety? A. Administering antipsychotic medications as prescribed. B. Establishing a trusting therapeutic relationship. C. Implementing a safety plan to prevent self-harm. D. Encouraging the client to participate in recreational activities. The answer is C. Implementing a safety plan to prevent self-harm. When caring for a client with schizophrenia experiencing command hallucinations, instructing self-harm, the priority nursing intervention is to implement a safety plan to prevent self-harm. A safety plan involves identifying strategies such as removing harmful objects, providing constant supervision, and involving the client in their own safety planning. This intervention aims to protect the clients from acting on the hallucination instructions and ensure their well-being. Question number 13. A nurse is caring for a client diagnosed with antisocial personality disorder who frequently violates others' rights. Which nursing intervention is most appropriate when setting boundaries with the client? A. Enforcing strict consequences for boundary violation. B. Establishing clear, consistent, and firm limits. C. Avoiding confrontation to prevent escalation. D. Allowing the client to negotiate boundaries. The answer is B. Establishing clear, consistent, and firm limits. When setting boundaries with a client diagnosed with antisocial personality disorder, the most appropriate nursing intervention is to establish clear, consistent, and firm limits. Clients with antisocial personality disorder often test boundaries and disregard other rights. By setting clear limits, the nurse establishes expectations, promotes accountability, and provides a framework for appropriate behavior. Question number 14. A nurse is caring for a client diagnosed with post-traumatic stress disorder (PTSD) who experiences nightmares and flashbacks. Which nursing intervention takes priority in managing the client's symptoms? A. Encouraging the client to avoid situations that trigger flashbacks. B. Assisting the client in processing traumatic experiences through therapy. C. Administering anxiolytic medications to reduce anxiety and arousal. D. Teaching the client relaxation techniques to manage distressing symptoms. The answer is D. Teaching the client relaxation techniques to manage distressing symptoms. When caring for a client with post-traumatic stress disorder experiencing nightmares and flashbacks, the priority nursing intervention is to teach the client relaxation techniques to manage distressing symptoms. Relaxation techniques such as deep breathing, progressive muscle relaxation, or guided imagery can help the client reduce anxiety, promote a sense of calm, and cope with distressing symptoms associated with PTSD. Question number 15. A nurse is caring for a client diagnosed with bipolar disorder who is experiencing a manic episode. The client has not been sleeping and is engaging in risky behavior. Which nursing intervention takes priority in managing the client's safety? A. Administering mood stabilizing medication as prescribed. B. Setting limits on risky behaviors to ensure the client's safety. C. Encouraging the client to engage in calming activity. D. Facilitating a support group for clients with bipolar disorder. The answer is B. Setting limits on risky behaviors to ensure the client's safety. When caring for a client with bipolar disorder experiencing a manic episode, the priority nursing intervention is to set limits on risky behaviors to ensure the client's safety. During a manic episode, clients may engage in impulsive and dangerous activities. Setting limits helps protect the clients from harm and provides a structured and safe environment. Question number 16. A nurse is caring for a client with schizophrenia who is experiencing auditory hallucinations. Which nursing intervention is most appropriate in addressing the client's hallucinations? A. Ignoring the hallucinations to avoid reinforcing them. B. Encouraging the client to engage in reality testing techniques. C. Administering antipsychotic medication as prescribed. D. Allowing the client to isolate themselves to cope with the hallucination. The answer is C. Administering antipsychotic medication as prescribed. When caring for a client with schizophrenia experiencing auditory hallucinations, the most appropriate nursing intervention is to administer antipsychotic medication as prescribed. Antipsychotic medications are the mainstay of treatment for schizophrenia and help reduce the severity and frequency of hallucinations. Medication adherence is crucial for symptom management and promoting overall stability. Question number 17. A nurse is caring for a client with a history of substance use disorder who is attending a support group. The client expresses feelings of guilt and shame related to past behaviors. Which response by the nurse is most appropriate? A. You need to let go of your guilty and focus on the present. B. Others in the group have experienced similar feelings. You are not alone. C. Guilt is a normal response, but you should try to forget about the past. D. You should try to avoid dwelling on negative emotions like guilt. The answer is B. Others in the group have experienced similar feelings. You are not alone. When a client with a history of substance use disorder expressing guilt and shame, the most appropriate response by the nurse is to acknowledge the client's feelings and provide support. Assuring the client that others in the group have experienced similar emotions helps normalize their experiences and fosters a sense of belonging. This response can promote empathy, understanding, and validation with the support group setting. Question number 18. A nurse is caring for a client diagnosed with obsessive compulsive disorder (OCD) who is fixated on hand washing. Which nursing intervention is the most appropriate to help the client manage the obsession? A. Encouraging the client to resist the compulsion to wash hands. B. Providing distractions and engaging the client in other activities. C. Teaching the client relaxation techniques to reduce anxiety. D. Assisting the client in developing a structured routine for hand washing. The answer is A. Encouraging the client to resist the compulsion to wash hands. When caring for a client with obsessive-compulsive disorder (OCD) fixated on hand washing, the most appropriate nursing intervention is to encourage the client to resist the compulsion to wash hands. In exposure and response prevention therapy, a commonly used treatment for OCD, clients are gradually exposed to the feared situation or trigger, hand contamination, while resisting the compulsion hand washing. This approach helps the client learn healthier coping mechanisms and reduce the impact of obsessions and compulsions on their daily life. Question number 19. A nurse is caring for a client with dementia who frequently exhibits aggressive behaviors. Which nursing intervention is most appropriate in managing the client's aggressions? A. Administering sedative medications to calm the client. B. Implementing a consistent daily routine and structure. C. Isolating the client to prevent harm to others. D. Restraining the client when aggression occurs. The answer is B. Implementing a consistent daily routine and structure. When caring for a client with dementia who exhibits aggressions, the most appropriate nursing intervention is to implement a consistent daily routine and structure. People with dementia thrive in predictable environments that provide structure and familiarity. A consistent routine can help reduce confusion, anxiety, and agitation, thus decreasing the likelihood of aggression behavior. Question number 20. A nurse is caring for a client with borderline personality disorder who is engaging in self-harming behavior. Which nursing intervention is most appropriate to address the client's self-harm tendencies? A. Setting limits on self-harming behaviors. B. Encouraging the client to express their emotions freely. C. Administering sedative medication to promote relaxation. D. Allowing the client to engage in self-harm as a coping mechanism. The answer is A. Setting limits on self-harming behaviors. When caring for a client with borderline personality disorder who engages in self-harming behavior, the most appropriate nursing intervention is to set limits on self-harming behaviors. Establishing clear boundaries help protect the clients from harm and communicate that self-harm is not an acceptable coping mechanism. The nurse should explore alternative coping strategies and encourage the client to engage in healthier ways of managing their emotions and stress. Question number 21. A nurse is caring for a client diagnosed with Alzheimer's disease who experiences sundowing. Which nursing intervention is most appropriate to manage the client's symptoms? A. Administering sedative medications to promote sleep. B. Providing a well-lit environment in the evening. C. Encouraging daytime napping to reduce fatigue. D. Implementing a consistent bedtime routine. The answer is D. Implementing a consistent bedtime routine. When caring for a client with Alzheimer's disease experiencing sundowing, the most appropriate nursing intervention is to implement a consistent bedtime routine. Sundowing refers to increased agitation, confusion, and restlessness that often occurs in the late afternoon or evening in clients with dementia. A consistent bedtime routine, which may include activities such as gentle music, dim lighting, and relaxation techniques, can help promote relaxation and improve sleep pattern. Question number 22. A nurse is caring for a client diagnosed with anorexia nervosa who refuses to eat. Which nursing intervention is most appropriate to address the client's refusal to eat? A. Providing high-calorie, nutrient-dense foods. B. Encouraging the client to participate in meal planning. C. Allowing the client to skip meals to maintain control. D. Administering appetite stimulants to increase food intake. The answer is B. Encouraging the client to participate in meal planning. When caring for a client diagnosed with anorexia nervosa who refuses to eat, the most appropriate nursing intervention is to encourage the client to participate in meal planning. Involving the client in decision making and providing autonomy within appropriate boundaries help promote a sense of control and ownership over their recovery. Collaborating on meal planning can also increase the client engagement and commitment to improving their nutritional intake. Question number 23. A nurse is caring for a client with bipolar disorder who is experiencing a depression episode. The client expresses feelings of hopelessness and states, "Nothing will ever get better." Which response by the nurse is most appropriate? A. You should focus on the positive things in your life. B. It sounds like you are feeling really hopeless right now. C. Why don't you try distracting yourself with something enjoyable? D. You need to snap out of this negative thinking pattern. The answer is B. It sounds like you are feeling really hopeless right now. When a client with bipolar disorder is experiencing a depressive episode expressing feelings of hopelessness, the most appropriate response by the nurse is to acknowledge the client's feeling and reflect their emotions. Responding with empathy and understanding validates the client's experiences and fosters a therapeutic relationship. This approach helps create a safe space for the client to express their emotions and facilitates further explorations and support. Question number 24. A nurse is caring for a client with postpartum depression who is having difficulty bonding with their infant. Which nursing intervention is most appropriate to promote parent-infant bonding? A. Encouraging the client to spend time alone to recharge. B. Providing educational materials on infant care and development. C. Assisting the client in identifying positive aspects of parenting. D. Arranging visits from family and friends to offer support. The answer is C. Assisting the client in identifying positive aspects of parenting. When caring for a client with postpartum depression who is having difficulty bonding with their infant, the most appropriate nursing intervention is to assist the client in identifying positive aspects of parenting. Postpartum depression can impair the parent's ability to connect with their baby and experience positive emotions. Helping the client recognize and focus on the rewarding aspects of parenting can enhance bonding and provide a sense of fulfillment and connection. Question number 25. A nurse is caring for a client with a history of substance use disorder who is in the early stage of recovery. Which nursing intervention is most appropriate to support the client's recovery process? A. Encouraging the client to attend self-help support. B. Providing incentives for maintaining sobriety. C. Restricting the client's access to visitors and phone calls. D. Administering medication to reduce withdrawal symptoms. The answer is A. Encouraging the client to attend self-help support groups. When caring for a client with a history of substance use disorder in the early stage of recovery, the most appropriate nursing intervention is to encourage the client to attend self-help support groups such as Alcoholics Anonymous (AA) or Narcotics Anonymous (NA). Support groups provide a sense of community, peer support, and opportunities for sharing experiences and coping strategies. These groups play a crucial role in maintaining sobriety and promoting long-term recovery.